Hello, I'm Dr. Kerr. I'm a general practitioner in Florence. I've been here for the last 21 years and I look after the Anglophone community. It's been a worrying time for some people here in Florence with the coronavirus, and I'm here to answer some of your questions. Masks are helpful for stopping the spread if somebody's contaminated, has an infectious condition going on. It should help stop the spread to other people. How useful it is to stop you getting the virus from other people around you isn't really based on strong science. Taking the children to the park is a splendid idea. The important thing is to not congregate. The children should be playing separated from other friends. Walking your dog is absolutely fine. If there's any suspicion that you have the coronavirus, there's the helpline, the numero verde, which you can phone. You'll talk to an operator eventually, and they'll ask you the questions to see if you justify coming in to be tested. It's a very, very difficult question to answer. You have to really persevere. If you feel you're getting really, really sick, then you need to phone your doctor. For the coronavirus, there's no obvious antiviral that's been developed yet. There's no vaccine. You treat it as you would treat influenza, so paracetamol or acetaminophen in the US, ibuprofen, aspirin for the adults, lots of fluids, and wait and see. If it looks like there might be a secondary bacterial infection, then an antibiotic might be justified. For people that want to travel home, if they had a diagnosis that was positive, obviously they shouldn't be traveling. If there is a concern, they still want to travel, if they take as many precautions as possible, wearing a mask, washing hands very frequently, trying to avoid dense groups of people, then they should be fine to travel. It's impossible to think that you can quarantine an entire family until this crisis is over, which may last weeks or months. Same precautions when he comes home, hand washing, and that's all you can do. The Pronto Soccorso don't want you to go there directly, they want you to phone the helpline. General doctors' offices as well don't want people turning up without first being invited in or first phoning the hotline. For non-urgent things, for non-pregnant women, many doctors' visits, cosmetic issues, etc. could be postponed until after this crisis is over. For women who are pregnant, they should feel free to contact their gynecologist and see if that particular test at that particular stage of the pregnancy is an important one to do at that time, because many are very time sensitive. Almost exactly the same as influenza, so fever, cough, sore throat, runny nose. The medicines for these would be something for the fever, headaches, which would be ibuprofen, acetaminophen, which is paracetamol. To stock up on all your routine medicines that you take on a daily basis. There's no evidence to suggest that these will run low, but nothing's impossible. It's obviously a lot of people are very worried, very panicked about this problem. For the vast majority of people, they'll come through it and they'll be absolutely fine. Just keep an eye on any symptoms and call for help if you're concerned.